Good evening. My name is Stephen Drummond. I am a nurse at Mission Hospital here in Asheville, North Carolina. I am also a student that is enrolled through UNC Wilmington and a part of the RN to BSN online program. And right now I am currently taking a health policy course. And in this course, we were assigned a group topic that we would want to debate on. And the topic we chose was the North Carolina House Bill 434, Suicide Risk Referral, Mental Health, and Teen Violence. And with this bill, I am wanting to highlight some key points that were mentioned in it. The first point I want to mention is that each local board of education shall adopt and implement a suicide referral protocol and a mental health training program for school personnel who work directly with students in the grades of kindergarten through 12th grade. And the protocol shall at minimum do the following. One is to inform school personnel of suicide risk referral procedures, including the provision of training. Two is to establish crisis teams. Three is to inform school personnel on how to identify and intervene in an appropriate situation. Later on in this bill, it highlights the mental health training program, and the things that they're wanting to implement and address is youth mental health, suicide prevention, sexual abuse prevention, and sexual trafficking prevention as well. So here are some statistics that I'm wanting to share with you about adolescents and teens dealing with mental health and human trafficking as well. According to the World Health Organization, 10 to 20% of children experience mental health problems such as anxiety, such as harm to self, eating disorders, and substance abuse. And according to the United States Department of Health and Human Services, depression is the most common mental health disorder and affects about 1 in 8 adolescents and young adults each year. The U.S. Department of Health and Human Services also notes that the major depressive episodes have increased nearly a third from the years 2005 to 2014 amongst the adolescent population. And according to the National Institute of Mental Health, the second leading cause of death amongst the ages 10 to 34 is suicide. And here's another statistics that I wanted to share from the National Human Trafficking Hotline, that in the state of North Carolina, it was reported between the years 2007 to 2019, there have been 6,726 cases that were contacted and 1,560 total cases that include moderate high-risk cases and high-risk cases of human trafficking reports. And these were victims that have called in and reported issues that are happening amongst their homes or schools or wherever they were located. So I am here to share these statistics with you to show that I am in support of the North Carolina House Bill 434. And I couldn't be more proud of this state for having this bill passed. I do share the concern, however, that teachers could possibly experience burnout with having one more thing on their plate when they're already having to ensure that their students are being educated in a safe learning environment. However, teachers are spending the majority of the time with kids throughout the course of a week, and parents are counting on school personnel to take care of their kids in the best way possible. And this is why I'm also in favor of House Bill 524 in North Carolina to be passed to ensure that there will be additional funding for school nurses and to ensure that there will be a safe ratio of school nurses to students. Right now in the state of North Carolina, it was reported by Rose Haven that the school ratio of students to school nurses is 1,086 students to only one school nurse. And school nurses can be very valuable to school personnel to delegate different situations and to know that there's someone else that can help in the need of a crisis as well. So I am asking you to be in support with me, along with Representatives Craig Horn, Carla Cunningham, Gregory Murphy, and Donna White, to join me in supporting this House bill to be passed. Thank you.